I'm Dr. David Mwesigye. I'm a gynecologist and obstetrician, and I work at Rwanda Mental Hospital, and I'm one of the first trainee of Merck Fertility training program, and I was trained as a fertility specialist. So Rwanda Mental Hospital is a government, referral teaching hospital. We as doctors working there, being a mental hospital, we receive 90% of people from the rural areas. So this service that was initiated there was initiated with the goal of, helping these patients receive infertility service at a low cost. I have to mention that the IVF clinic at Rwanda Mental Hospital is the first of this kind in the public hospital. So it's the first of this kind in Rwanda. So infertility really is a public health problem. Like also, the World Health Organization has come to recognize that infertility, patients need to be also, catered for. So the challenge that we face, I was trained as a gynecologist for sure, but being in sub-Saharan Africa, whereby one of the government priorities are like HIV, we face a problem. So these patients are always not left, their statistics are not well known. I mean infertility patients, because of having Ebola, because of HIV, you think that these infertility patients, their statistics are not yet there, known currently. But really the problem, the numbers are yet to be found, because now that the World Health Organization recognized that infertility is a public health, it's also raising attention to start collecting statistics for these patients. The knowledge that we got from this training, the Merck Fertility training, was so helpful. Say that whenever I meet patients that have had this problem of fertility, we are to help them. Helping them is not all about even IVF. Like as a package of training, of this training, we learned a lot. We learned how to counsel patients. We learned how to raise hope for these patients. We learned how to provide affordable diagnosis, and we also tell them how IVF can be successful, and they go in with full confidence. So really, with the skills that we got from Merck Foundation Fertility Training Program, is helping us, impact on our community in all aspects of infertility. This infertility training that I got from Merck Fertility Training Program, it really had a good outcome to the patients. I can see it because now, in a week, I can receive the minimum 20 patients per week in outpatient who are coming to seek for this. And really these patients, they come with full, confidence, and also I handle them with the skills that I got. So this, this training program did a lot to help the patients, because to myself, I evaluate the information I was giving before the training and the information I'm giving now I evaluate myself is totally different. Really, the success stories that I can tell you after undergoing a training from Merck Fertility Training Program, I have had women conceive. And really they've had transfers to where I work, Rwanda Mental Hospital, and they even in other clinics we help. even doing outreach program, because we do outreach program by government. I see them and I've helped them and they have conceived, and really they are happy. And before the training hadn't got any success, but now I'm seeing it working. So it's really grateful. Really, this training is very vital, very important. So being the first batch to be trained in Rwanda in fertility training by Merck Fertility Training Program, we are very few. So I will recommend other gynecologists to take up this training, say that you can be many to tackle this problem, because being few doctors it's not enough to handle. I also now contribute to training in the school, postgraduate, the skill that I got, because I know we are very few. I've come to be working in the referral hospital. I do teach undergraduate, postgraduate, and also doing our Society of Gynecologists. I do give some training to skill teaching to see how we can give approach to infertility. So I encourage other doctors to take up this training, because I now am different from where I am, and so I would also wish them to be different from where they were, to be able to help our community. I thank Merck more than Mother for having given us this opportunity to training, to get skills in infertility, and we promise that through their cooperation we are going to aim high and help our women. So thank you very much, and together we can. So thank you very much, and keep seeing how we are growing and helping our community.